This segment is all about how to treat under eye wrinkles. Now, there's a difference between under eye wrinkles and actual crepey or thin skin under the eyes. So if the main issue is that you feel like the skin under your eyes is thin, and even if you have dark circles under the eyes, then I would recommend you go to the section for thinning skin under the eyes or dark circles. But if it's truly the issue as actual wrinkles under the eyes, especially when you smile and make various facial expressions, then this segment hopefully will give you some information on how to treat it best. So, unfortunately with under eye wrinkles, there aren't any great treatments. There are some decent treatments, but none that are really, really great. The first thing that I would recommend that you start by is by considering a retinol-based eye cream. Now, retinol, technically Retin-A, is scientifically proven, tretinoin, which is a prescription strength version of Retin-A, is scientifically proven to thicken the skin that it's applied to. Now, this does take many months for it really to work, and so a retinol is a weaker form of the prescription strength tretinoin. It's an over-the-counter version. Now, because the eyelids are such thin skin, it's actually the thinnest skin of the body, you do need to be very careful with what you apply to it, and you can't apply something really strong like a prescription strength Retin-A or tretinoin. Because of that, there are eyelid creams that are made that are retinol based, and retinol based eyelid creams are not nearly as potent because once again you're going to apply it to the thin under eye skin, but they can definitely help with time to gradually thicken that skin. Now, thickening the skin may decrease the wrinkles just by getting that skin thicker, but mainly it treats the thinning part of the skin and the crepiness, not necessarily the lines, okay, although it can gradually improve those as well. So by gradually thickening the skin using a retinol-based eyelid cream, you can gradually improve those under eye wrinkles. The other thing to consider is a fractional laser treatment. Now, what this is that the old style lasers that were used back in the 80s and 90s were called ablative lasers. They would literally burn all the skin on the surface and work their way down, just burning the skin until it got to the deeper skin or the moderate depth skin. And that way you can really rejuvenate the skin in that fashion. But because you're burning the skin, all the skin from the top down, they were very aggressive treatments, and it created a lot of redness, a lot of discomfort, a long recovery time. Because of that, these lasers, these ablative lasers, the CO2 typically, are not used all that commonly anymore. And now people are using fractional lasers. So with a fractional laser, it's the same idea. You still are burning that skin and getting the heat down to the deeper skin to rejuvenate it, but you're only doing a fraction of the skin at a time. It's like a grid type of thing. So by doing this, the recovery time is much shorter, it's much less pain, much less of the oozing and the redness and all of that, but you do typically necessitate more than one treatment to get your optimal results. Now, this works fairly well under the eyes if you've got wrinkles or if you've got skin that's even a little bit loose, it can help by using that fractional laser there. Now, here at YPS, we don't have a fractional laser that we do this for. The reason is, honestly, is these are typically treatments done by the physician. And in my practice, I do so much surgery that I just don't have time to use the device. So financially, it doesn't make sense for me to purchase what's essentially a $100,000 machine and only use it once or twice a month because I just don't have time to otherwise use it. So if you are considering a fractional laser treatment, if you're in the Metro Detroit area, we do have offices that we can send you to. Otherwise, if you're from outside of this area and you want to see somebody in your immediate vicinity, then ask around for a fractional laser to treat the wrinkles under your eyes. The other option that we have is what we call a pinch skin removal. So what we can do is in surgery is I can make a little incision right underneath the eyelashes and remove a pinch of skin. By doing that, I can cut some of the skin out so you have less redundancy of the skin. Now, this won't treat all the wrinkles necessarily, but it gets rid of some of that skin redundancy. So like the retinol-based eye cream will thicken the skin and won't necessarily actively remove a wrinkle, the pinch skin removal will remove the excess skin, but in the skin that's left over, it doesn't necessarily get rid of those wrinkles. So I hope that makes sense to you. So once again, that's why there aren't any great treatments. There's nothing that specifically will just smooth out those under eye wrinkles in one treatment. You can use retinol eye creams. I would combine that with considering a fractional laser treatment. If there's actually excess skin there that you want to remove, then we can literally cut that out in surgery with a pinch skin removal. Now you may be wondering though, well, what about surgery? What about a lower eyelid lift? Won't that improve my wrinkles? Not so much. So this is a patient who had a lower blepharoplasty, which is a lower eyelid lift. Lower eyelid surgeries are basically meant to remove puffiness, to remove the puffy fat that creates the bags under the eyes. They're not necessarily made to get rid of actual wrinkles. Now we can remove the puffy bags under the eyes, and we can combine that with a pinch removal of some of that skin, and so that can be an overall nice improvement. But if you've got fine lines under your eyes, some of them are definitely still going to be there afterwards. So it can definitely help if you have puffiness, if you have the bags under the eyes, but it's not specifically just for the lines. So I hope that makes sense for you. If you are considering treating your under eye wrinkles, start with the retinol cream for your eyes. If you want to take the next step, then a fractional laser treatment would be the next thing. If you've got other issues, like if you feel like there's extra skin there that has developed with age, then a pinch skin removal can help. Or if you've got that excess skin with the puffiness, then that's where the blepharoplasty comes in. And if you're thinking about a lower blepharoplasty, then I would encourage you to look at the section for puffiness under the eyes, where I go into the lower blepharoplasty surgery in a complete pre-consultation there. We go over all the details there. Okay. Well, I hope this has been helpful for you for the under eye wrinkles. This is a problem that a lot of people have, but it's hard to get completely resolved, almost impossible to. But you can get some improvements if you take some of the steps that I have showed you on this video. Thank you.